The GNR, as it is known, is an independently produced annual analysis of state of the world's nutrition. It's been published since 2014, and it has acted as a critical benchmark for progress when it comes to nutrition, and it is also a source of accountability for where we need to improve. Now, let me invite Dr. Corinna Hawkes, Professor of Food Policy and Director at the Centre for Food Policy at the City University of London, who will be presenting the report. Corinna.
Thank you very much. I'm delighted to be here this morning to be launching our new publication, the 2018 Global Nutrition Report, which goes live on our brand new website. It's an honour for me to be here presenting this report to you, ladies and gentlemen, and your excellencies, on behalf of the independent expert group of the Global Nutrition Report, and in particular my co-chairs, Professor Jessica Fanzo and Emorn Udam-Lesclay, who are with us today, as well as the 80 experts who have contributed to the report. This is truly a collaborative effort. So each year, the Global Nutrition Report collates, analyses, and communicates data with the goal of guiding and inspiring accelerated action on nutrition. And we have done so for 5 years. This year, in our 5th year, we bring together an unprecedented amount of data to shine a light on the progress that has been made and where progress has not been made. We dig down into the burden of malnutrition. We have a brand new chapter for the first time ever on the importance of diets, and we highlight critical areas in need of attention, as well as looking at the financing and commitments, and throughout the report, featuring spotlights which highlight actions that have been taken that can inspire change. So what progress did we find in reducing malnutrition? This is not a new story, but it is the biggest story. It is the biggest area of progress, the decline of stunting globally. But we also know that when we start to look at the country level and the regional level, that the picture varies. For example, the number of stunted children in Africa is still going up. And this year, we took advantage of some really exciting innovations in data to not just look at differences between countries, but within countries. And here we find extraordinary differences within countries. This is the example of Africa, where, for example, in Nigeria, you have some places where stunting is halved in the past few years, and other areas where stunting has barely changed at all. We don't just look at trends overall, but we look at how well the world is doing in meeting the nutrition targets that member states of the World Health Organization adopted in 2012 and 2013. And these are the targets that we track in front of you. And we found that almost 50% of countries are on track for at least one nutrition target. So it's not quite 50%, and it's just one nutrition target, but it's something. It's some progress. And the area of most progress is the target on exclusive breastfeeding, the target of 50% prevalence by 2025, with this slowly, very slowly, but surely moving towards that target at 41% now. So that is the only target globally which we classify as having made some progress. Unfortunately, for the other targets, they are all off track globally, most noticeably for anemia and obesity, but all the other targets as well, including for stunting. So while we see this tremendous gains in stunting made in terms of the declines overall in the number of children, we are still off target for reaching that target by 2025 of 100 million children, itself a high figure. And we highlight in the report that one of the reasons for this is this increasing amount of malnutrition in all its forms in fragile and conflict states and states affected by environmental change that have this fragility, with the enormous amount of refugees we see in the world today. So we see increasing amounts of stunting, but we also, and wasting in these states, but we also see issues of all forms of malnutrition that needs to be managed and treated in these situations of not just short-term crisis, but long-term protracted crises, and we highlight that. And we highlight the status among women. We show that, sadly, rates of anemia and women's underweight have scarcely changed. Women's underweight is actually not featured as a target, but we specifically bring the data in that we have to highlight it as a critically important issue. And while these forms of malnutrition have barely changed, obesity has been going up among women. Now, we would like to report on a greater number of micronutrient deficiencies rather than just anemia, but we can't because we don't have the data. And we shine a light on the fact that we lack data on micronutrient deficiencies, and we desperately need more if we're properly to understand and tackle this problem that affects many, many people around the world. We do know that obesity and overweight continues to rise. This graph just shows obesity here among women and among men, as it does among adolescents, where interestingly obesity is higher among boys and it is among girls. And we shine a light overall, and it's been mentioned already this morning, on the importance of adolescent nutrition and the task that lies ahead. And then we bring together the different forms of malnutrition and ask the question, how many burdens of different forms of malnutrition are countries actually facing? And what we find is that 88% of the countries for which we have data on these three forms of malnutrition, childhood stunting, anemia, and women's overweight, have more than one burden of malnutrition. So it's become normal that countries do not just experience one form of malnutrition, but experience at least at least one, with 41 here experiencing 3. And if we added more forms of malnutrition to that, that number would only grow. But we drill down even deeper this year and don't just look at the overlapping forms of malnutrition in countries, but within children. And what we find is that millions of children are both stunted and wasted. And millions of children are stunted and overweight at the same time. Meaning that we have almost 25 million children experiencing one of these forms of overlap, most of whom are in Asia. The largest proportion of whom are in Asia. So that's malnutrition. The status of malnutrition, a mixed picture, showing that malnutrition is a universal problem and has many different forms. So now let's go and look at diets. I'm afraid the situation with diets globally is pretty diabolical. Let's start by looking at the diets of infant and young children. By diets, we include breastfeeding. We include diets from the very youngest child all the way up into adulthood. And again, we present data which is disaggregated, and we do a lot more of that this year, among wealth quintiles and urban rural. And by doing so, we show that the diets of infants and young children, it's breastfeeding, minimal acceptable diet, minimal dietary diversity, is bad whether you are rich or poor, whether you live in an urban or rural environment, in all countries around the world. It's a universal problem. And we show, using new data on sales of packaged foods, including infant formula, that sales of these products are growing rapidly, both for products up to the age of 6 months and up to 36 months. They're growing at an unprecedented rate, despite all the work that is going on to tackle exclusive breastfeeding and to promote breastfeeding and healthy complementary feeding. Now, we've known for a long time that if young children don't consume enough nutritious foods, that's going to be bad for their nutritional status. We highlight also that is equally applicable to adults. And the reason being that if we don't have enough whole grains, fruits, vegetables, fish, nuts, and seeds, and so on, that has a very, very significant impact on the burden of disease. Heart diseases, some cancers, and diabetes, leading diseases in the world today, very directly affected by inadequate intake of these nutritious foods. And again, it applies to all income groups. Not eating enough vegetables, whole grains or legumes, and yet we're all drinking too much soda, which is arguably displacing these more nutritious foods. And it's the same for adolescents. In new analysis here, in the report this year, we show that up to 33% of school-aged children eat no fruit at all on a daily basis, and yet up to 59% consume sugar-sweetened beverages. We show as well that that sales of industrially processed, manufactured, packaged foods are either high or growing in regions of the world. Now, this wouldn't be a problem if these foods were aligned with healthy diets. But we show in a new analysis of over 23,000 products from China, from South Africa, from Mexico, and some from high-income countries like the UK and New Zealand, that 69% on average are not aligned with healthy diets. And the proportion which are not healthy is higher in the lower and middle income countries than it is in the higher income countries. So little progress in actual diets, but we do identify two important areas of progress. There is progress when it comes to developing and delivering effective policies and programs to improve what we eat. We've already heard that more countries now have fortification programs, and that's been a great success story in the case of iodine, with a vast drop in the number of countries experiencing iodine deficiency following fortification. We know that governments are doing more and more to try and reduce the amount of diets associated with obesity and diet-related chronic diseases. For example, according to the World Health Organization, around 59 countries have imposed taxes on sugar-sweetened beverages, the majority of which are for health and nutrition reasons, albeit not all. We see exciting action at the city level as the problem of urban malnutrition becomes increasingly recognized. We're seeing cities getting together and beginning to tackle the problem. And we highlight the example of Amsterdam, where a truly multi-sector program is associated with the decline of obesity in that city. And then we see these intense efforts at the community level showing success, with the example already given of the Alive and Thrive programme in its effect of improving minimum dietary diversity very rapidly. And there also has been tremendous progress in this space in the growth of data initiatives. So we always used to complain about the lack of data in diet, and we have to still complain about it. But what is the case is that there are so many more initiatives designed to collect, collate, analyse, and engage with people in collecting that dietary data. So we can really look forward to an improvement in the amount of data in the diet space very soon. I'll end by providing a brief assessment of progress in financing and commitments. Now, we know that we don't have nearly enough money in nutrition, and we can see that there by looking at that less than 0.5% figure on the right-hand axis. But at the same time, we do have some consolidation in the amount of disbursements that are going to nutrition, as you can see here on this slide, this steady increase in consolidation. That's from overseas development assistance. The Nutrition for Growth funding target that was set by the donors to that initiative was met 2 years early, with an additional 640 million being pledged in 2017. And our analysis at the Global Nutrition Report of whether those commitments were smart shows that all of them were, and that's something we've been calling for some years. We've seen a decline in the amount of money going to diet-related NCD and obesity projects, still very, very tiny, but a bit of an increase this last year of data. We did an analysis of domestic spending from a sample of 25 countries, showing that the early indications that the amount that countries are actually funding domestically is growing, and more countries are actually analysing how they are spending their nutrition funding. That's the funding, and we also see signs that countries themselves are just more committed to this problem. A few years ago, relatively few countries actually had hard nutrition targets that they were driving towards. Now we have 81% we have practically 100% coverage of targets, and 81% of those targets have 3 or more nutrition targets, showing that they're not just concerned with one form of malnutrition, but a broader range of nutritional problems. So there's been areas of progress, and there have been areas of no progress, and there's been areas somewhere in between. But where there has clearly been progress is in knowledge. We know so much more than we did before, and I hope some of what I've just shown you indicates that. So the uncomfortable question to hold ourselves accountable is not so much why things are so bad, but why are things not better when we know so much more than before, and we have so many examples of actions that can inspire and inform effective change. So at the end of the report, we identify 5 critical steps where we need fundamental change and progress. And these are not new calls, these are not new things, they have been talked about before, but they are the 5 areas where we think here we need transformational change if we are to draw on all of that knowledge and really accelerate action. And I'll just touch on 2 of them. The first one is that we need a new mindset. We need a new mindset that's about tackling malnutrition in all its forms. Rather than going in and just thinking about our single form of malnutrition that each of our programs is concerned with or our policies are concerned with, we say, what are the different forms of malnutrition in this community, in this country, in this individual? And how can we most effectively tackle them together as one united community? And secondly, I'd like to highlight this call for a focus for galvanized, concerted action to improve diets everywhere. Diets are a common cause of malnutrition in all its forms, and they are therefore a common solution to malnutrition in all its forms. The situation is dire, it's holding back progress, but we know there are many examples at the community, city, and national level of where we can affect change to ending malnutrition in all its forms. Thank you very much.